Topic number 16, Fundamentals of Malformation Surgery, second part, lecture Shevchenko Alexander, Baltic Federal University, Medical Institute, Kaliningrad, 2020. So, congenital heart diseases. About 80% congenital heart defects are known. They occur in nearly 1% of newborns. 1/3 of these patients die within the first days or month of life. Since the defects are not correctable, to normalize blood circulation is possible only with the heart transplant. The most common defects are ventricular septal defect, open arterial duct, and aortic coarctation. There are three groups of birth defects, depending on the presence of abnormalities that cause mixing of arterial and venous blood, and accordingly a change in the color of the skin. In the first case, the skin color is normal. Arterial and venous blood do not mix. This group of defects includes aortic coarctation, aortic stenosis, and pulmonary artery stenosis. Heart defects of the white or pale type, they are characterized by a pallor of the skin and mucous membranes, which is caused by mixing of arterial and venous blood through defects in the atrial, intraventricular septum, or through an open arterial duct. More often, arterial blood enters the venous vessels. Heart defects of the blue type, they are characterized by cyanosis of the skin and mucous membranes, shortness of breath, and attacks of suffocation. This is due to the discharge of venous blood into the arterial bed and, as a result, a decrease in the saturation of arterial blood with oxygen. Diagnosis of congenital heart defects is difficult and requires special complex research methods: echocardiography, Dopplerography, angiocardiography, probing of the heart cavities, etc. Coarctation. The disease is characterized by slow development of the child. Sometimes there are phenomena of infantilism. This is underdevelopment of the child. Infantilism means. To establish a diagnosis such as sign as the absence of a pulse on the vessels of the lower extremities are important if there is a pulse of good feeling and tension on the upper extremities, with a slight narrowing of the aorta. Blood flow compensation is sufficient and the patient can live to adulthood. The optimal age for surgery is 3 to 10 years. The operation consists in resecting the narrowed part of the aorta and restoring its patency by applying an end-to-end anastomosis. With a significant extent of narrowing, Isthmoplasty is used with the help of the left subclavian artery. Less often, aortic prosthetics are used. So, after all vessels which give the blood to the upper part of the body, we have slight narrowing of aorta on its descending part of the arch. So, all the blood which going down to the lower part of the body is undersupplied, and sometimes if you see these people, upper part of the body is very heavy like an athlete, and lower part of the body it's not so developed in these patients. Open ductus arteriosus is a white type heart defect. It is characterized by lagging the child's physical development from their peers, frequent pneumonia. There is a pronounced pallor of the skin. With auscultation, a rough systodiastolic noise is detected in the second intercostal space to the left of the sternum. Treatment: operative at any age. The operation consists in ligating the duct with a ligature or using a mechanical stapling device. Recently, the method of endovascular surgery is used, duct embolization. So through the catheterization of the femoral vein, we go to the open ductus arteriosus and left here special stent which block this passage. Ventricular septal defect. The most common congenital heart disease, and in combination with other defects, it commonly occurs. The defect is characterized by paleness of the skin, shortness of breath, lagging child in development. There is also an increase in pressure in the small cycle of blood circulation, shortness of breath, hard breathing, wet wheezes. Treatment: surgical. The operation is performed on a dry heart in condition of artificial circulation or deep hypothermia. The opening in the partition is sutured or plastic closure is made using synthetic materials. Atrial defect is characterized by a lag in physical development, shortness of breath, and circulatory disorders. To clarify the diagnosis, ultrasound, echocardiography, and cardiac catheterization are used. Treatment: surgical removal of the septum defect by suturing it or closing it with plastic material. For the purpose of echocardiography, better to use ultrasound from endoscopy from the esophagus. We have special equipment to provide transesophageal echocardiography. Transposition of the main vessels is a blue type defect. It is expressed in the departure of the aorta from the morphologically right ventricle and the pulmonary artery from the morphologically left. Complete transposition of the main vessels. The average life expectancy for this heart disease is about 13 months. Clinically, the defect is severe and characterized by cyanosis of the skin, mucous membranes, shortness of breath, attack or suffocation, which increase with moving. Patients are not mobile enough. Echocardiography and X-ray contrast methods play a role in establishing the diagnosis. Palliative surgery is to create a shunt for mixing of arterial and venous blood at the level of the atria. In radical surgery, the defect of the arterial septum is eliminated and the direction of the blood flow from the whole veins through the mitral valve to the left ventricle and pulmonary artery is changed, and blood flow from the pulmonary veins through the atrial communication to the right heart and aorta. Transposition of the main vessels, healthy heart, and transposition of main arteries. So we see here that our arch of aorta going from the right ventricle and aorta from the left ventricle. But sometimes transposition of the main vessels occur with the defects in ventricle septa. So blood can go from left to the right and from right to the left. Left aortic trot is the most common of the blue type Weiss defects. In this case, there is a defect in the interventricular septum of the heart, a shift to the right dextral position of the aorta, stenosis of the output section of the right ventricle and the right ventricle's hypertrophy. Clinical manifestations are characteristics of blue Weiss, pronounced cyanosis, shortness of breath, attack of suffocation, slowed physical development, and limited mobility. Treatment: radical surgery is performed in condition of artificial blood circulation and hypothermia. It consists in eliminating the defect of the interventricular septum, prosthesizing the pulmonary trunk, removing hypertrophied muscles of the output tract of the right ventricle, followed throughout narrowing uh, of the pulmonary trunk or outlet of the right ventricle atrial septal defect and right ventricle myocardial hypertrophy are characteristic treatment, as in the tetralogy of followed. The followed tetrad. So on the left picture we have normal heart, on the right picture we have heart with tetralogy of the followed. Increased outflow in aorta, partial obstruction of right ventricle outflow to lungs and pulmonary valve, ventricular septal defect and thickened right ventricle. Rarely there are congenital defects of the blue type, the common arterial trunk and tricuspid valve atresia. Surgical treatment of these abnormalities is a complex reconstructive operation. Some congenital heart defects in modern conditions are incompatible with life. Children die in the next few days, weeks, and less often months after birth. Such defects include a 2 or 3 chamber heart, atresia of the aortic arch, and a common arterial trunk. In the recent years, it has become possible to help such patients. The first successful heart transplant were performed. Malformations of the stomach and digestive organs. Umbilical fistulas are the result of non-infection of the yolk duct or urinary duct urachus. The umbilical fistulas are lined with epithelium. Non-infection of the yolk duct can be complete, which is manifested by the formation of a small intestine fistula. The intestinal contents there are separated from the fistula. With partial obliteration of the fistula, there is no communication of the intestine with the external environment through the fistula. There is a protrusion of the ileum in the form of a diverticulum, Meckel's diverticulum. Blind protrusion of the cecum can be of various shapes and width, cone or cylinder. The diameter can reach the width of the intestine. The length of the diverticulum is 3 to 8 cm. It is located at a distance of 30 to 80 cm from the ileocecal angle. Ileocecal valve. Complete non-infestation of the urinary duct is manifested by a functioning vesico-umbilical fistula. Incomplete overgrowth of the formation of the diverticulum of the bladder. Diagnosis. Put on appearance of urine or intestinal contents from the fistula when straining or pressing the abdominal wall. To clarify the diagnosis, fistulography is performed. The penetration of a contrast agent into the intestine or into the bladder clarifies the origin of the umbilical fistula. The presence of a fistula is an indication for surgery, excision of the fistula. Meckel's diverticulum. A Meckel's diverticulum, a true congenital diverticulum, is a slight bulge in the small intestine present at birth and a vestigial remnant of the amphora-mesenteric duct, also called the Wittlein duct or yolk stalk. It is the most common malformation of the gastrointestinal tract and it's present in approximately 2% of the population. Can manifest itself as a development of an inflammatory complication, diverticulosis, or intestinal obstruction. Treatment: surgical removal of the diverticula. Here we see on the left non-inflamed Meckel's diverticulum. It lays near the ileocecal valve, maybe less than 1 meter. And on the right, we see inflamed Meckel's diverticulum. The hernia in which because the vertical can go, called uh, hernia of Littre. Embryonic hernia. In this case, the part of the abdominal wall in the navel area is represented by a thin, transparent shell that covers the internal organs. Through the defect of the uh, abdominal wall, the insides are protruding, covered with the stretched and thinned elements of the umbilical cord and elements of the parietal peritoneum. In a newborn, a pouch of a rounded shape with diameter of 5 to 10 centimeters or more is determined in the navel area, which passes into the umbilical cord covered with a shiny transparent shell. When the child screams, the protrusion increases. The intestines and the liver can be seen through the walls of the sac. Treatment: surgical performed according to the principles of herniated section. The operation is performed in the first hours after birth, since delay in the operation is fraught with the risk of developing peritonitis. Here we see the umbilical hernia, and you must find by yourself what does it mean amphalocele and what does it mean hysteroschisis. Here we see hernia of the umbilicus. Congenital pyelorestenosis. Narrowing of the output part of the stomach is caused by an abnormality of development in the form of hypertrophy of the muscles of the pylorus and violation of their innervation, which causes a mechanical obstacle to the passage of food. The disease appears most often at the third, fourth week, less often at the age of the 4-5 months. Children vomit like a fountain and lose weight. The stomach is stretched and vomit becomes an unpleasant smell. In lean children, it is possible to determine the enhanced motility of the stomach in the left upper quadrant. Treatment: operative. Perform pylorectomy, longitudinal dissection of the serous membrane, the muscles and the pylorus to the mucous layer. So here we have the picture of the pyelorestenosis. So we perform surgery in the way we make longitudinal incision, and then we combine this part from side to side, so narrowing in the stomach which go to the duodenum is really wide open. It's phenoplasty. Hirschsprung disease is caused by congenital underdevelopment of nerve plexuses in the rectosigmoid part of the colon with expansion of the overlying parts of the colon. The intestine becomes wide, elongated, and its wall is thickened, hypertrophy of the muscle layer. The disease is manifested by constipation and a sharp increase in the size of the abdomen. Constipation is often observed from the first year of child's life. Sometimes there is no chair for several days. Chair means stool. Okay. It is my problem of translation. With Hirschsprung disease, which is mild course, children can sometimes live to adolescence and adulthood. To establish the diagnosis, X-ray examination are used. Treatment is surgical resection of the denervated part of the colon. And this person who lived to the adolescence and adulthood, even to the old years, they have very frequent constipation as a main sign, but they live with this condition for all their life, so they didn't know even what something abnormal is happened with them. So they think this is normal to have stool once in 3 or 5 days. So Hirschsprung disease. Here we see part of the colon, not even called rectosigmoid, and rectum without ganglion cells, so it didn't pass the stool. So upper part of the colon is widely distant. Atresia of the anus and rectum. The defect is rare. In newborns, there is no anus, there is no discharge of meconium, fecal masses, and intestinal obstruction develops. The children are in the serious condition. In some cases, atresia of the anus or rectum is combined with intestinal fistula. In boys, between the cecum and the bladder; in girls, between the intestine and the vagina, or the vestibule of the vagina. In the presence of fistula, there is a discharge of fecal masses with urine, or they are discharged into the vagina. If there is a fistula, the disease proceeds more easily. Narrowing of the anus occurs after the age of 1 year. It is characterized by difficulties in defecation, constipation, fecal blockage. Treatment. Surgical. The operation is performed in the first hours after birth. Its purpose is to eliminate atresia and ensure normal passage of the fecal masses. So here we see atresia of the anus. This child didn't have any anus at all. Malformations of the genitourinary system. We have kidney abnormalities are manifested in change in the shape, size, quantity, and position of the organ. There are aplasia, agenesis of the kidney, the absence of the kidney, an additional kidney, hypoplasia of the kidney, a decrease in size and decrease in its functionality, dystopia of the kidney, a change in its position, thoracic dystopia, moving the kidney to the chest, pelvic, moving the kidney to the pelvis, etc. Horseshoe kidney, a fusion of the upper or lower poles of the kidneys. Polycystic kidney, always a bilateral process characterized by the replacement of the parenchyma of the organ with multiple cysts of various sizes. Kidney cyst, a solitary cavity formation in the parenchyma of the organ filled with fluid. Diagnosis of kidney malformation is possible using special research methods: radiography, scintigraphy, echography, computed tomography, functional studies, and treatment. Conservative, symptomatic. In case of complications, surgical treatment is indicated. Nephrectomy in the presence of a second kidney and the presentation of its function. In case of kidney failure, a kidney transplant is performed. On this picture we have the bilateral polycystic kidney. As I say, even the shape of the kidney we didn't recognize at all in this picture. And on this picture we have horseshoe kidney with which connects with its lower poles, but it can occur in the higher poles of the kidney. Malformation of the penis. Hypospadia, absence of the distal part of the male urethra. The opening of the urethra can open at the base of the penis head, in the rear of the penis trunk, or near the scrotum. In the latter case, the hanging part is absent. The scrotum is split into two halves, resembling the labia, and urination is of the female type. Epispadia, non-infection of the anterior wall of the urethra in the distal part of the penis, or through it. non-infection opening of the anterior valve urethra. With complete epispadias, urinary incontinence is observed. Treatment: surgical displacement of the opening of the urethra, straightening of the cavernous bodies, plastic of the urethra. So here we see different types of hypospadia. Distal and coronal hypospadia, proximal hypospadia, distal and glandular hypospadia, distal and glandular hypospadia, distal and coronal hypospadia, distal and coronal hypospadia, midshaft distance penile hypospadia, and midshaft distal penile hypospadia. And on this hand we have epispadia. Difference between epispadia and hypospadia. So hypospadia, we have opening from the urethra on the lower part of the penile body or the glands, and epispadia means that we have opening on the upper part of the penis. Extrophy of the bladder. The absence of the anterior wall of the bladder and the section of the anterior abdominal wall occurs in one child out of 50,000 newborns. The bladder is turned out and its mucous membrane is exposed. Treatment: surgical plastic surgery of the bladder, urethral transposition into the rectum. Clitorhidism. Delay of intrauterine movement of the scrotum of one of the both testicles, which are delayed in the retroperineal space or inguinal channel. The diagnosis is based on the absence of the one or both testicles in the scrotum. Treatment: surgical reduction of the testicle with its inguinal location, hormone therapy. Here we see bladder extrophia. And on this picture we have the cryptorchidism. We must understand that testicles go from the retroperitoneal space to the scrotum through the inguinal channel. But it is normal if this way through take 1 year. If the testicle is placed at age 1 year in the retroperitoneal space or in the inguinal channel, it is not normal. It is cryptorchidism. Malformations of the limbs. Violation of the development of the limbs can lead to the absence of limbs, fingers or part of the limbs, to the appearance of additional limbs, fingers, an increase in the volume of the limb, macromelia, or individual fingers, macrodactyly, is more often associated with circulatory disorders, the presence of arteriovenous fistulas. The absence of a limb may be complete ectromelia, possibly the absence of the distal part of the limb, hand, foot, lower leg, forearm, hemimelia, the absence of the proximal part of the limb, the shoulder, hip, as a result of which the normally developed lower leg, forearm, hand, or foot being from the trunk is called phocomelia. Improvement of the limb function can only be achieved by prosthetics, which are used in children to ensure their growth and development. Congenital dislocation of the hip. It is expressed by a violation of the position of femoral head, which is displaced and located outside the joint cavity. Dislocation can also be bilateral, with not only a violation of the provisions of the elements of the hip joint and structural change. The femoral head is underdeveloped marked hypoplasia. Glenoid cavity of the ileum is weakened. So here is the congenital dislocation of the hip. Please say to me, is it a child or adolescent or adult? Think about it. 10 seconds. If you think this is adult, you're right. But why do you think so? You must look and on the growth plate, because this is child with congenital displacements of the hip. As you can see, we have growth plate, and we see that our head of the femur must go to its joint, but not on these pictures. Modern diagnosis with a dislocation allows you to conduct a full correction. The newborn is examined immediately after birth. In this case, the violation of passive movement in the joint withdrawal rotation is characteristic of hip dislocation. If the dislocation is not diagnosed in a timely manner, then during the development of the child there is a further displacement of the femoral head, and the dislocation is detected when the child begins to walk. Gait is sharply disturbed. The child walks waddling from the foot to foot, dog gait. There is a shortening of the leg. The appearance of the child when viewed standing in profile is characteristic: pronounced lumbar lordosis, pelvic deformity, shortening of the limb. Radiography allows not only to clarify the diagnosis, but also to determine the degree of hypoplasia of the articular surfaces and the position of the femur. Treatment. Dislocation involves eliminating the displacement of the head, setting foot on the head, and immobilizing the limb with special orthopedic devices or a plaster cast. I place here the dog because we have a sign, dog gate. Open please in YouTube every video where you can find the dog and look how it's walk. And people step by step tilting from the side to side like a dog. Please look this video and remember this to the whole your life. Congenital clubfoot. The diagnosis is easily established by the shape of the position and the position of the foot. Treatment starts as early as possible. It includes manual settling of the foot and fixing it. Massage and physical therapy. In later periods, surgical treatment is used. Ligament crossing, tendon grafting, or wedge-shaped resection of the foot bones with the foot in the correct position and fixation with a plaster cast. Arthrogryposis, multiple joint contractures due to underdevelopment of the muscles of the limb with symmetrical localization. Stiffness, resection of movements require conservative therapy, massage, physical therapy, and physiotherapy. So here you see the pictures of these people. Very severe conditions. Syndactyly, a malformation expressed in the presence of splices between the fingers. Fusion of the fingers may be skin or bone. The malformation is caused by a violation of embryogenesis. Up to 2 months of intrauterine life, the fingers are connected by webs and then separated. Finger separation is performed surgically at the age of 2 to 3 years. Polydactyly. Increasing the number of fingers occurs both on the hands and on the feet, may be accompanied by a violation of the function of the hand or foot, surgical treatment, removal of additional fingers. Here we see syndactyly. We have no distance here at all, but syndactyly can occur at any parts, between any fingers. And here we see polydactyly. We have one extra finger on the right hand. Macrodactyly. Increase in the volume of individual fingers. If the defect leads to a violation of the function of the hand or foot, the finger is amputated. Ectrodactyly, reducing the number of fingers. One or more fingers or toes may be missing. To restore the function of the hand and eliminate cosmetic defects, fingers are transplanted from the foot to the hand using microsurgical techniques. Here we have the macromelia. In this case, exactly macrodactyly. And here we see extrodactyly. Thank you for your attention. I hope you find something new from this lecture.